Hello everyone, my name is Aida. The question for this discussion is whether the healthcare field is ready for disruptive innovation. I do believe healthcare is ready for disruptive innovation, but its success depends on how organizations implement new technologies and redesign the way care is delivered. Disruptive innovation transforms healthcare by making services more accessible, affordable, and efficient. As Christensen, Rayner, and McDonald explained, disruptive innovation is more than introducing new technology. It transforms how products and services are delivered over time. In healthcare, examples include telehealth, artificial intelligence, wearable health technologies, remote patient monitoring, and digital health platforms. Healthcare is more ready for disruptive innovation today because of an aging population, increasing chronic diseases, and the need to deliver high quality care while controlling costs. Traditional healthcare models alone are no longer enough to meet these challenges. The COVID-19 pandemic showed how quickly healthcare systems can adapt. Telehealth expanded rapidly, demonstrating that many patients and providers embrace new technologies when they improve access and convenience. Christensen, Grossman, and Hem explained that disruptive innovation requires more than technology. It also requires business models that deliver care more efficiently, affordably, and accessibly. Telehealth is a good example. The technology allows patients to connect with providers remotely, but it becomes truly disrupted when paired with a value-added process business model. A value-added process business model delivers standardized evidence care through efficient and repeatable clinical processes. By supporting virtual appointments, follow-up care, electronic scheduling, and insurance reimbursement, telehealth expands access to care, improves efficiency, and lower costs. This shows that changing how healthcare is delivered is just as important as technology itself. As a medical laboratory scientist working in a hospital, I have seen firsthand how innovation improves patient care. One example is digital door signs that replace laminated insulation signs. These signs provide real-time patient updates, improve communication, and support patient safety. Although this is not a disruptive business model on its own, it demonstrates how thoughtfully implemented technology can improve clinical workflows and prepare organizations to broader innovations. My experience has shown me that introducing new technology is not enough. Healthcare organizations must redesign their processes and adopt business models that support innovation. Otherwise, even the best technology may only improve the existing system rather than truly transform it. There are still challenges. Healthcare organizations must address privacy, cybersecurity, staff training, regulatory compliance, and equitable access to technology. In addition, some patients may lack internet access or digital skills, and some healthcare professionals may resist changes to familiar workflows. As Hessingler explains, healthcare innovation is often slowed by organizational complexity, regulatory challenges, and resistance to change, making effective leadership essential for successful implementation. For disruptive innovation to succeed, healthcare leaders must keep patients at the center of implementation. Technology should support healthcare professionals, and every innovation should be evaluated for safety and effectiveness. In conclusion, I believe healthcare is ready for disruptive innovation because the need for change is significant and technology continues to advance. My experience with digital door signs shows that innovation is already improving healthcare operations. However, long-term success requires more than adopting new technologies. As Christensen, Grossman, and Hwen explained, healthcare organizations must also embrace business models that support affordable, accessible, and patient-centered care. When technology and innovative business models work together, disruptive innovation can improve patient outcomes, reduce costs, expand access to care, and strengthen the healthcare system. Thank you.